You want answers? I'm as mad as hell, and I'm not going to take this anymore. You want answers?
You have offended my family.
I think I'm entitled. You want answers? I want the truth.
And you have offended a Shaolin temple.
You can't handle the truth.
Surely you can't be serious.
I am serious. And don't call me Shirley.
Radical Rant.
Welcome back, folks. In today's Radical Rant, we're going to take a look at a piece that was written up in psmag.com entitled, "Is Obama Delivering on His Promise of a 21st Century Approach to Drugs?" Now, you know, we've covered this kinder, gentler drug war for a while here at the Russ Belville Show, and we've shown the meet the new boss, same as the old boss. We've shown you the statistics of how Obama is not that much different than Bush with regard to recreational marijuana and far worse on medical marijuana. We've covered this in various different angles, but today I am so happy to see the government itself is beginning to agree with us. That's right. The Gov't Accountability Office produced a report here that was released just yesterday, I believe. And according to this report, they say when the Obama administration released its 2013 drug control strategy, drug czar Gil Kerlikowske called it a 21st century approach to drug policy. Quote, "It should be a public health issue, not just a criminal justice issue." End quote. But again, the GAO has just released this report, and this is what the report found. Quote, "As of March 2013, GAO's analysis showed that of the 5 goals for which primary data on results are available, 1 shows progress, and 4 show no progress." That's 20%, Mr. Obama, and every school I ever went to, that was an F. For instance, GAO found that there's actually been an increase in HIV transmissions among drug users and drug-related deaths, as well as no difference in drug use among teenagers. So much for the 21st century approach. Here are some of the points made in Obama's 2013 drug control strategy, some of the bullet points that were their goals. And now that we've had 4 years to see how well their new 21st century kinder, gentler approach has fared, we're not seeing much in the way of results. The first point Obama made was break the cycle of drug use, crime, delinquency, and incarceration. They also go on to say, quote, "We cannot arrest our way out of the drug problem," end quote. Yet they still arrest people for drugs, but we cannot arrest our way out of the drug problem. And sure enough, there have been fewer drug arrests. According to the FBI, drug arrests dropped from 1.8 million in 2007 to 1.5 million in 2011. But overall, the government spends roughly the same proportion on the drug policy budget on law enforcement as was spent during Bush's final years in office. So they're spending as much or more money and arresting fewer people. That's actually more of a waste, isn't it? More money spent per arrest? In President Obama's 2014 budget proposal, 38% of the budget is allocated for domestic drug law enforcement, and another 20% allocated to crack down on drugs in the U.S. borders and abroad. And this is where we've pointed out that the Obama administration's budgets are 58% toward law enforcement and the can't do the math in my head off the top of my head here. 42%, thank you. 42% related to drug treatment. And that 3-to-2 disparity of about 60-40 or close to it is the same ratio we found in the George W. Bush administration. In fact, Bush's ratio was a little bit lower in a couple of those years. The other thing the Obama administration has done is renewed funding for the Justice Assistant Grant Program. Now, this was formerly known as the Byrne Grants, and what those are grants from the federal government to local law enforcement for the express purpose of catching people for drugs. Federal government doesn't give any money to local law enforcement to catch rapists, or murderers, or molesters, or arsonists, or burglars, or thieves, or vandals. But they give federal tax money, billions of dollars, to local law enforcement so they can buy, up-armored vehicles and Kevlar body armor and, stealth, whatever. Obama has raised that money. And that money, those burn grant monies, essentially amount to a profit motive for policing drug crimes over other crimes. Also, according to the Bureau of Justice Statistics, some good news, the number of inmates in state prisons dropped roughly 2% from 2010 to 2011. But most of that, 70%, is because of a decrease in California's prison population after the Supreme Court forced them to release prisoners because they were too overcrowded. And guess which prisoners have to get released first? It's not the drug prisoners, because a lot of them have mandatory minimum sentences. So, yes, we have fewer prisoners, but a lot of that is because we're releasing actual criminals in California so that we can make room for all the drug users. Also, according to the Congressional Research Report, the number of inmates in federal prisons continues to rise, increasing over 3% from 2010 to 2011. And over half the federal prison population is drug offenders. Another bullet point in the 2013 drug control strategy: support alternatives to incarceration. Now, the president has requested $85 million to go to drug courts. Since 1999, drug courts have increased from just about 500 to 2,734 today. And we can spend a whole rant on what the problem is with drug courts, specifically for marijuana users. And that is, they treat all marijuana use as abuse. They send people to rehab that don't need rehabilitation, and they end up taking a space from someone who actually needs it. And a 2011 GAO report found that while drug courts reduced recidivism, there's not enough data to fully assess their effectiveness. Another bullet point from the Obama administration: increase addiction treatment services. And indeed, Obama has increased funding for addiction treatment, $9 billion in his latest budget. That's up 18%. But despite that, only 1 in 10 of the 21.6 million Americans who need drug or alcohol addiction treatment was able to actually get it. The number of people receiving treatment has stayed the same since about 2002. Now, some of this may change, because as Obamacare goes into effect, the Health Care Act, people with drug addictions can finally get that covered on their insurance. So that is a definite positive of the Obama drug control strategy, that people can use their insurance funds. Once Obamacare goes into effect, they can use their insurance funds to be able to pay for drug treatment. And again, we're not anti-drug treatment here at the Russ Belville Show. Drug treatment saved my father's life. But people have to choose it. People have to want it. You can't force them to get better for their own good. And another Associated Press analysis says that when Obamacare kicks in, these current clinics will be overwhelmed because the state-level budget cuts have gone strongly against the drug treatment facilities. And treatment centers in 2/3 of the United States are at or over 100% capacity. So while the federal government may allow you the insurance to be able to get drug treatment, there might not be a bed available for you. And especially when these beds are taken up by people arrested for marijuana and sent there by a drug court. Another point for the Obama administration was to review laws and regulations that impede recovery from addiction. The collateral consequences, the public benefits, unemployment, getting kicked out of Section 8 housing. But the problem with that, while Housing and Urban Development has told public housing not to disqualify former drug users from public housing or Section 8, the City Housing Authority gets to determine its own rules with respect to that. And a lot of them, most of them, ignore HUD and go ahead and discriminate against prior drug users. They had the goal of reducing drug-induced deaths, and the GAO notes that drug-induced deaths and emergency room visits increased from 2009 to 2010, and most of it likely due to pharmaceutical abuse, which contributes to many more overdose deaths than illegal drugs or alcohol. Now, one good thing Obama did in 2009, he attempted to end the federal ban on clean needle exchange programs, for people, intravenous drug users. But Congress wouldn't let him do that, so we can't really hang that on him. And finally, Obama's goal for the 2013 was to curtail illicit drug consumption in America. Well, the GAO notes the prevalence of drug use among teens and young adults has stayed the same since 2009. Now, this just goes to show that the new window dressing of this war on certain American citizens using non-pharmaceutical, non-alcoholic, tobacco-free drugs is just that, window dressing. If you continue to treat adult, responsible drug use as if it's a crime, and adult drug abuse if it's a crime, you're going to continue to get the results that we've gotten for the past 40 years, Mr. Obama. It's meet the new boss, same as the old boss. It's a prison with bars or a prison with a drug rehab counselor, but it's still a prison. You're still punishing people for what they do to themselves. We need to legalize not just marijuana, but legalize drug use, decriminalize drug use. Nobody should be a criminal simply for what they do to themselves. Now, if they affect other people, I'm all for getting law enforcement involved and protecting the rights of other people. But as Obama still remains opposed to legalization, it's time for us to yell louder and louder for him to get the hint. And maybe by the end of this term, maybe as he's leaving office, he can leave us with some decent drug policy. Governor Corzine did it in New Jersey. It could happen here. That's all the time we got for Hour 1 here. Toker Talk Radio is next. We'll be talking with Lindsay Reinhart live here in Boise, Idaho. For Brian the Red back in Portland, I'm Radical Russ. Till next time, take care of each other, Tokers.